Good afternoon, everyone. My name is Zahab Aleezada. I am an MS1 at UAB Hastings School of Medicine, and today I'll be discussing with you some really exciting research that was done in Dr. Claire Edwards' lab at the University of Oxford. So my mentor there was Danielle Cotton, an MD PhD candidate, and our project focused on understanding a novel microfluidic technology and how it can be utilized to investigate to the tumor bone microenvironment in prostate cancer bone metastasis. So in the bone microenvironment, it has been known that advanced prostate cancer cells behave very differently depending on the cell line. So our goal for this project was to understand specifically the PC3 cell line, which is known to be incredibly aggressive and metastasizes very quickly. Now, past research has shown that insulin plays a role in modulating the effect of advanced prostate cancer cells. However, this effect has not been directly investigated in the PC3 cell line itself. Another aspect of this research is to utilize metastatic niche cell labeling to then monitor specific cell lines. And with this metastatic niche labeling, we are having the cancer cells express the gene for GFP so that they can fluoresce green. And we also are having them express the gene of M-cherry so that they can express M-cherry tagged particles and then express these to the bone cells in the microenvironment. So how did we do this? So for this project, as I mentioned, we used a novel microfluidic technology, which was fluid-walled microfluidics. Now, a good analogy that I like to use when presenting this is imagine that you're in your kitchen and you take some water and oil, and they both don't mix. So utilizing the same process, we then take a petri dish and we line it with some water-based cell medium. On top of that, we use an FC40 oil, and then we're able to use a needle to draw various different shapes. And now the device that we're using is an iota-sized device, microfluidic device. And that device utilizes the needle to then jet FC40 oil, and it can create various different shapes. Now, the exact shape that we utilized for this project was a dumbbell shape. So here in the middle part of the slide, we have a dumbbell shape that has two chambers that are connected by a narrow conduit. So on one side of the chamber, we are depositing the PC. On the other side, we will have whatever chemoattractant, drug, any kind of condition that we are wanting to understand. So then after that, what we decided to do is we decided to test three different conditions. And we had so we decided at 72 hours. And then the second part of our research was to develop a labeling system. And so we were able to use the same microfluidic technology to then create a grid. So on the bottom of the slide, there's a 96 well grid. And we're able to prep the PC3 cells. And once we have successfully found that certain PC3 cells are able to take up the M-cherry and express it, we can then use single cell picking to do clonal expansion. So it helps us reduce the amount of time, amount of tools that are used. So once we utilize the machine to then pick each single cell, we then try to clone them. And on the next slide, I will show you the results of our cloning. So we were able to have one colony out of the almost 800 cells that we had utilized for the experiment. And as we can see on the top hand, we have the cancer cells successfully expressing the green fluorescent protein. And on the bottom, we have those same cancer cells expressing the M-cherry particles. So currently, at the moment, we are conducting in vitro experiments, co-culturing them with bone stromal cells. And in the future, we're hoping to do this in vivo with mice. When it comes to the migration, graph. So that's and they but the yellow line is just so you're able to lay some work about chemical understand them, their cell line. School of Medicine Education Department for research trip abroad, and the Edwards Group at Oxford University for hosting me for 2 months there. Yes. So we did do a couple of replication experiments. However, nothing really was significant as yet. And just during my short time there, I wasn't really able to better understand the etiology. But yeah, no, you can go ahead.
Where do you see the translation of this work to kind of clinical setting?
So in a clinical setting, we're hoping to utilize this to then possibly, for example, if we have a patient come in and they have prostate cancer, we take a biopsy of that, and then we can possibly predict the metastatic potential of that cancer. So that's our hopeful clinical application of this project. I'm not sure. That's a good question, but I will take that into future considerations as we just explored this in this one cell line. It was a very short experiment, but definitely we'll be looking into that. Yeah.
Why?
So the reason we decided to use insulin was because we had a lot of past research that showed insulin had played a significant role in other prostate cancer cell lines. And my mentor had already done some other work with that. So we were like, why not try it in the PC3 cell line as well? Oh, awesome. Yeah. No, it's okay.
I'm just curious, what particular value
So that's a great question. So the reason that we utilized microfluidics was because when we're doing standard cell culture and we are doing clonal expansion work, sometimes we can have a cell and it, like when we're diluting it, we may, like we're trying to guess, we're hoping that when we, clone it, it's expressing the M-cherry protein. However, with this, the microfluidics, we can pick a single cell, and then we can take those single cells and then culture them. And then we know for sure by utilizing, I forgot to mention this earlier, but we utilize an IncuSite. And that IncuSite imaging device can then be used to monitor the cell growth hour by hour. And then we're able to see more specifically the M-cherry particles being expressed by the prostate cancer cells. So it's a more like streamlined and efficient method versus utilizing just, the colony that we had and then trying to guesswork it and then develop those cells. Any other questions? Yeah, thank you.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.